Surgical asepsis lecture. Surgical asepsis is the complete destruction of organisms on instruments or equipment that will enter the patient's body. This is mandatory for any procedure that invades the body's skin or tissue, such as surgery. Techniques are performed on such a routine basis that they become an unbreakable habit. So it's important to develop proper habits in the beginning. Sterilization. So there is sanitization, disinfection, and sterilization. Sanitization and disinfection must be done prior to sterilization. Sanitization is the cleansing process that reduces the number of microorganisms to a safe level. Disinfection is the process of killing pathogenic organisms or of rendering them inactive by physical or chemical means. We think of sanitization as removing debris from instruments and disinfection using a chemical on a countertop or when we are soaking instruments prior to sterilization. Sterilization is the destruction of all microorganisms. The autoclave is a method of sterilization. It is important to have heat-resistant gloves, fluid-resistant gloves, lab coat, and face and shield goggles for the sterilization process. Usually there is a utility room where surgical instruments are placed after a procedure and then after sterilization. Usually the utility room has a clean side of the room and a dirty side of the room. So the dirty side of the room contains all the instruments that have been used in a patient procedure, and the clean side of the room is after the instruments come out of the autoclave and are completely sterilized. The autoclave is used, and the action of the autoclave is steam under pressure. The steam simultaneously heats and wets the object. When the cycle is finished, the chamber has cooled and the microbes have been totally destroyed. The average temperature for the autoclave should be between 121 to 123 degrees Celsius. Incomplete sterilization happens when the steam is too wet or too dry and does not work properly. This can happen due to the presence of residual air, and it means incomplete sterilization. Wrapping of materials. Maintenance of sterility depends completely on the wrapper and the method of wrapping. So it is important to wrap instruments properly and using the proper materials. Materials must be permeable to steam but impervious to contaminants. Wrapping instruments. It's important to inspect wrappers for holes before use. Hinged instruments must be in the open position. You must place gauze sponges at the tips of sharp instruments to prevent holes being poked through. Place a double folded towel on the tray first. All instruments are usually double wrapped. Material in the polypropylene pan takes longer in the autoclave. Place instruments into the bag so that the handles face out when the bag is opened. Label the wrapper package according to the contents, the date that it was sterilized, and your initials. All packages should have sterilization indicators. Chemical sterilization indicators like autoclave tape, which changes color when exposed to steam, and what you will see when it's exposed to steam is black lines throughout the tape. This tape typically looks like white masking tape before the process is done, and then afterwards you will see black lines through it. Biological sterilization indicators include pour strip indicators, and test indicator kits can also be used. How do the test indicator kits work? They use ampules of Bacillus stereothermophilus, which is destroyed at 121 degrees Celsius. The ampoule is sent to the lab after sterilization for analysis of any type of microbial growth that may occur. It is important for each medical office to have quality assurance records for the office sterilization. Each office should have a specific protocol to evaluate the quality assurance of autoclave. A log should be kept of the type of control test done when performed and the results. File the report for any failed tests. The report should also include the date and time of the correction along with how it was corrected. Loading the autoclave. Prepare all packs and arrange the load in a way that allows maximum circulation of steam and heat. So you want to make sure that there is space in between each package. Rest articles on the edges, but do not crowd them. Place packs in racks, wrap jars, bottles, trays, and place them on the sides. No need to wrap if the item does not have to be sterile afterwards. Unloading guidelines. Once the pressure gauge reads 0, stand back from the door and with heat-resistant gloves, open the door approximately a 1/4 inch. Allow the air to dry at least for 15 minutes. Remove the materials in the autoclave with gloves. Stand behind the door when opening. If sterilization is in question, autoclave again. It is important to let the materials dry and allow that 15 minutes after the door is opened, because if materials are handled and they are not dry, they are considered no longer sterile. The shelf life of sterilized packs, muslin and autoclave paper packs are considered sterile up to 28 days from the date of sterilization. Polypropylene autoclave bags are sterile for up to 6 months. All sterile packs should be stored on dry, dust-free covered shelves or in drawers. And a lot of times we use sterilized packs when there are a set of instruments that the physician uses for every procedure, and for a specific type of procedure, I should say. So there are a couple of different types of sterilization. There is ultrasonic sterilization, which is recommended for sharp instruments, but there is also gas and chemical sterilization. Gas sterilization machines have a longer processing time and are hazardous. They are not typically used in the physician's office. Chemical sterilization is used for instruments that cannot be exposed to high temperatures of steam. Sterilizing solution must be mixed exactly according to directions. Chemical baths are for up to 8 hours or longer and the lid is closed. After instruments have been immersed in chemical sterilizing agents, they should be rinsed with sterile water.